Our topic of the day is cardiology, and the following portion of Live at 9 is sponsored by Stern Cardiovascular Center. Joining us for this discussion is one of their physicians, Dr. Daryl Sneed. Thank you for joining us, and talk to us. What is cardiovascular medicine?
Thank you for having me. Cardiovascular medicine is not only a disease of the heart, although that is what we focus as cardiology, but it also is cardiovascular, includes the other arteries and vessels in our body. Very important to know that with Stern Cardiology, yes, we examine your heart. We have specialties and different subspecialties, even in cardiology, to go through that to help guide you and prevent disease developing, but also peripheral arterial disease and other vascular beds are also encompassed with our cardiovascular medicine. So I don't want people to think that, oh, they don't have a heart problem, they only have vascular or other issues relating to the cardiovascular beds in our body, so they wouldn't need to see someone else. We will help guide you and structure your treatment and specialty guidance for that you're dealing with.
Right, and so what exactly does Stern do to help to prevent and treat?
Well, we have different screening tests that we guide you through, and based on the recommendations from the American Heart Association and the American College of Cardiology, we guide you with your treatment after those screening tests if it is a person who does not have known disease. And those that have known disease, obviously there's different guidelines we follow and meet those metrics to make sure you're on the appropriate medical therapy and getting the appropriate test to try to prevent another event from happening. So we take it from primary prevention, which is preventing it from ever happening for those that have risk factors, and then we have secondary prevention which is trying to prevent it from happening again. And both of those are very important with our population here in the area having multiple risk factors.
Okay, and so the significance of high blood pressure in this all, talk to that, please.
So high blood pressure is something that is very common, seen by all physicians, and all are very well educated. It's important to know that the blood pressure recommendation standard is less than 130/80. And that's important because high blood pressure is referred to as the silent killer. And the reason that's so important is because feeling these small changes in blood pressure are often not felt until an event occurs. Approximately every 20 millimeters of mercury that the blood pressure goes up on the top, which is systolic, then the risk of a major heart attack or stroke doubles. So if you're consistently running 150 rather than 130, or 140 versus 120 in those 20 interval increments, then the risk of a major stroke or heart attack doubles. So by us guiding you with therapy and bringing your blood pressure down even 20 points, we could potentially lower the risk of a major stroke or heart attack by 50%, which is a huge, huge help for those in the area, given that cardiac and diseases and cardiovascular diseases is the #1 cause of death.
All right, thank you so much, Dr. Sneed, for joining us. And the preceding portion of Live at 9 is sponsored by Stern Cardiovascular Center.